and welcome to In Touch with Durham County. I'm Deborah Craig-Ray, General Manager of Strategic Planning and Innovation. It's probably been a while since you've seen us. There's this little thing called coronavirus that's kind of kept many of us in and taking a whole new look at the way we do things. Fortunately, we found a way to use Zoom to produce our show. And so we're happy to come back today and bring in some very good guests with us. Our first guest is our great friend, Derek Bowens, who is Director of Durham County Board of Elections. We've got this little thing called a fall election coming up, and he's going to tell us everything we need to know to get ready for that. And of course, a few months ago, I think it was in March, the world as we knew it changed substantially. Schools closed, businesses closed, county government closed, everything closed because of the pandemic. We've invited Chief Emergency Manager Leslie O'Connor and Public Health Director Rod Jenkins to tell us everything we need to know and all the experiences we've been through over the past few months. Derek, hi, and welcome. Thank you for joining us.
Hi, Deborah. Glad to be here. Thanks for having me.
Well, it's been a while since we talked. I think we got together before the March primary, and here we are looking at the fall election. How are you doing?
Oh, busy. Got a lot going on here at the Board of Elections, getting prepared for this massive, critical election. So a lot of work going on over here at the Board of Elections.
Absolutely, absolutely. Just exactly how do you do a successful election process during a pandemic?
Well, of course, as with most all of the county departments, this is certainly unprecedented in our world here. So we are working hard, utilizing guidance from the Centers for Disease Control, the Election Assistance Commission, and also the State Board of Elections as to best practices to allow for safe in-person voting, and also absentee by mail and other methods such as curbside voting. So it's essentially listening to public health experts as to what we need to do to make sure we have a safe and healthy voting environment and leaning on that and executing that.
Very good, very good. Now, what would you consider the most significant challenge in trying to produce this election process?
I think public perception is a big piece. Being able to educate people about what we're doing to make in-person voting safe, and there's many things we're doing. We're conducting electrostatic sprays of sites. We're doing daily cleanings at our one-stop facilities. Social distancing will be employed. Face masks will be employed. Just a lot of protocols. So getting that information out to people so that they can feel safe voting in person. We actually have a COVID-19 response page on our website now where we lay out our plan for safe in-person voting. But also, of course, dealing with huge volume of absentee by mail. Certainly, there's a lot of logistics preparation there and staffing increases. We've processed over 20,000 absentee requests here in Durham County, and the number continues to grow. So I would say, just making sure we coordinate that and also making sure that we educate the public about healthy in-person voting options.
Mm-hmm. Now, I know one of your challenges, of course, is making sure you have the staff that you need to do this work. Typically, when we think of election workers, we think of folks who are retirees mostly, but certainly the pandemic has put those folks in high-risk categories. So what are you doing to try to attract younger voters to be volunteers for you?
That's a great question. So we have the State Board of Elections actually created a Democracy Heroes campaign where they've distributed out a survey statewide to get people that may be interested in serving in polling places. So we've got a number of interested applicants through that program. We've also just had increased engagement based on our I Voted sticker contest. We got over 1,000 people that indicated interest, and they've been emailed. General outreach protocol we follow through social media. We've gotten a lot of interest. And another great item that I have to commend our county manager on is working with the Board of Elections to establish the Durham Elections Employee Participation Program,
Mm-hmm.
where we'll be able to use Durham County employees in polling places on election day. So we're feeling really good right now. We're recruiting like we've never recruited before, and we want to have way more to account for potential dropouts.
Right. So I know typically when we've talked on these shows, you've always encouraged people to early vote. Is that still the case? Has Durham County selected sites, and do we have a schedule?
We do, and I still encourage early voting to avoid long lines on election day. So Durham County Board of Elections unanimously passed an early voting plan comprised of 14 sites throughout the county, over 2,500 hours. It's the most robust plan in Durham County's history as it pertains to early voting. So we've invested in early voting. We want people to take advantage of early voting. It will be safe. There are protocols in place. Absentee by mail is certainly available, and we want to encourage people that have a serious concern about their health and well-being to take that option. There's no excuse this election, but we are working hard to make early voting as safe as possible, and we certainly want our citizens to employ that option.
Mm-hmm. Now, if someone is new to North Carolina, new to the area, how do they register to vote?
So there's a couple of ways. Of course, you can visit our website at decovotes.com to access a voter registration form that can be printed, completed, mailed to us, or brought in person. Additionally, there's a new online DMV registration portal. So if you're a DMV customer, you can actually register online. There's a link to that application on our website as well, and that's been heavily utilized. So that may be a better option for folks, especially in this environment, is to use the DMV resource to register online if they're existing customers.
Mm-hmm. Mm-hmm. Now, certainly we know that the presidential election is on the ballot. What are some of the other offices that our voters will have a chance to choose?
So locally, we have offices such as County Commissioner, Register of Deeds. State level, we've got NC House, NC Senate. We've got U.S. Senate. We've got several state offices, auditor, treasurer. So several offices on a wide spectrum across the state. So it will be a very long ballot, most likely a 2-page ballot based on the substantial number of contests that we have for the general election.
Mm-hmm. Now, is it possible to see what that ballot looks like ahead of time?
It is. We're currently waiting for ballot configuration to be done so that we can post sample ballots. We have to wait for the national parties to officially submit names to us. So once we get that information, we'll be able to go through our ballot proofing process and distribute those out publicly.
Mm-hmm. Now, going back to the whole issue of voting, certainly people who have challenges have concerns. I know you have ways for people who are handicapped to vote in a special area. Talk about that a little bit.
Yeah, so we do have curbside voting for in-person voting at our early voting locations and on election day.
Mm-hmm.
That option is for voters that, due to age and or physical disability, physical barriers, are unable to enter the voting enclosure to vote. So there will be either a designated lane or pathway for those voters to wait for assistance or to ring a bell to receive assistance, or it'll be designated parking spaces at our facilities for that service.
Mm-hmm. Now, unfortunately, over the past few months, we have seen other states have elections. Things have sort of gone off the rails a bit. I mean, some polling places have been closed. People have had very long lines. How well do you think our process will go in North Carolina?
Well, just putting emphasis with the benefit that other jurisdictions have had, when you look at the other states that have had some issues, is we've had some time to receive additional guidance from the CDC, to receive additional guidance from the EAC and other actors. So I feel good about the implementations we've put in place, but I think it's really important, if we want to avoid long lines, especially on election day, is that we employ options that are not available in many other states, such as early voting
Mm-hmm.
and absentee by mail. Durham County has invested what will be over $600,000 in early voting. So I think if that's utilized, I think we'll see, we will not see lines on election day as long as people decide to vote prior to election day, and I'll not attempt to show up on that one day.
Great. Now, I know that we talked earlier about you getting more volunteers. I know your normal staff is pretty small, and then you have to hire more people. And what kind of training are you able to do?
So for this election, it's funny, we actually planned on doing this before coronavirus, but we purchased an LMS, a learning management system, where all of our poll worker training will actually be done in an e-environment with some in-person options for those that need additional hands-on with the computer. But we'll be doing full online training prior to the upcoming election.
Great. Well, we're about out of time. What is the most important thing that our voters need to remember from our conversation today?
So I would say just, be aware there's a lot of mail coming from a lot of different entities. Always trust known resources. If you're ever unsure about materials that you've received, you can contact our office. We will give you the appropriate guidance regarding that documentation. Be vigilant in your knowledge or your resources for information. We're doing everything we can to combat misinformation campaigns, but we ask that you visit our website at Deco Votes and communicate with us to get the most accurate source of information about this critical election.
Well, thank you so much, as always, for joining us and sharing great information. We sincerely appreciate all that you do to help Durham County have successful elections year after year.
Thank you so much, Deborah. I appreciate it.
Yeah. So we'd like to thank you for joining us for this segment. We're going to take a quick break, and when we come back, we'll see you on the other side.
Because the fight isn't over yet.
You will see me choose to protect my community by wearing a face cover.
And even with my face covered,
you will see me.
As a son.
As a man with a never quit attitude.
As a fighter for change.
Join me in wearing a face cover.
To help stop the spread of the coronavirus.
Because this is one small act of kindness
that has the power to make a big difference.
Welcome back to In Touch. We're pleased to welcome two of the most critical leaders in our community right now. They are managing and directing our response to corona pandemic. Leslie O'Connor is Chief Emergency Management with our Office of Emergency Management, and Rod Jenkins is our Public Health Director for Durham County. Thank you both so much for joining us today. So Leslie, let's start with you. Give our people a short description of your role as emergency manager.
So related to my normal day-to-day job, my responsibility is to plan for what could be the worst case scenario for Durham County. And during the COVID pandemic, my responsibility is as the incident commander and the emergency operations center manager, working hand in hand with the public health director, Rod Jenkins, and working with all of our other partners to ensure that we're giving the best service and have the best response to this COVID pandemic for our residents of Durham County.
Mm-hmm, mm-hmm. Now, Rod, I'll just have to say, you had scarcely been in Durham when the COVID hit. You were just learning your way around, beginning to make contacts and that kind of thing. What's it like to manage a pandemic when you're new to the community?
I'll tell you what, it makes it a lot easier when you got a seasoned professional like Leslie to lean on. But I will say that it's been a pleasure to work alongside Leslie as the incident commander. But Deborah, the challenges never cease. For the most part, where do I begin? I'll start off by letting you know that our longtime preparedness coordinator, emergency planner, had just retired. And I think she saw the writing on the wall and got out of here. but it really entailed learning who does what, both internally and externally. Had to learn that really quick. Had to determine who the major players were in order to get things done, and was able to kind of figure that out really quick. And then, of course, Durham is different as far as the city and county dynamic relationship. So I had to really understand why it was that, the city and the county was so, closely intertwined. And I had to do all of that on the fly. Then, of course, when you throw in a malware attack, that really creates an enormous challenge. So even with all of the above, Deborah, we were just still able to get a lot of things done in a very short period of time. And I'm proud of the staff for staying so resilient and in an effort to, really, really be able to produce a good result for our citizens.
Absolutely. And so, Leslie, Rod just mentioned the cyber attack. So the date of March 6th is forever burned in my brain. I mean, that was the day that both the city and the county were hit. And so that was about a week before we began to shut down for the pandemic. Talk about what was going on in those early weeks.
So we received the phone call on Saturday the 7th that the malware attack had occurred late Friday night. And for our role for emergency management, we were trying to figure out how to lighten the burden off of our information services and technology department. And what services could we provide for them, both to support them, but also to support the county and the city to ensure that we were able to continue functioning. A lot of our continuity of operations planning came into play. And we were requesting assistance from all over the state, as well as private partnerships, just to get laptops and internet service for everyone to be able to continue doing their work. Then we received the call from Rod about a week later that said, all right, COVID is real, it is here, and it's time for us to get started. And we transitioned our emergency operations center from our normal location to the Health and Human Services building. We set up an entirely new infrastructure, and we're able to bring in public health partners and all of our other partners into the room, socially distanced, and be able to keep all of those public health protocols in place to make sure that we all stayed safe and respond to two emergencies at the same time. Definitely not something I ever thought that would happen in our career. It is something that we were scheduled to do an exercise on the next week. And it just so happened that they both actually occurred at the same time. And I would be remiss if I did not say that we also had to plan for a hurricane and the possibility of a hurricane as well in all of this. So it has been a busy 2020, to say the least.
Now, Rod, talk to us about when Durham County got its first case and what happened during that time, and how did you work to inform our leaders about that?
Sure. Our first case seems so long ago when you think about the fact that we've had well over 6,000 cases. It did involve a traveler who attended a very large gathering conference that was out of state. That conference was attended by a prominent company within the Triangle area. And the traveler did, in fact, come back to Durham, and fortunate for us, ended up going to another state, started to feel bad, got tested, and that's where the test results were rendered. We were actually fortunate enough, Deborah, in that that individual was required to quarantine in that other state. So it was credited to Durham. However, we had a little bit more time to really think about things and to really ensure that we had our game together. So we were able to, having already convened our public health epidemiology team, we were able to monitor the activities of this individual, and then, again, to begin to really prepare for other reports of COVID positives. We did produce a situation report on a daily basis, which was very helpful in disseminating the information. And again, it was during the time when we were in the midst of the malware residue, if you will. So we were in turn able to produce that situation report and give it to the department heads so to keep them in the loop. Then, of course, we in turn began the process of convening what we call our multi-agency coordination call, which we call our MAC call. And that's letting our elected officials know exactly what's going on. And man, it went from 5 days a week to 3 days a week to I think 2 and now 1. And we're pretty soon is going to be on a monthly basis. So we've come a very long way. Then, of course, to really, really let our residents and Durham community at large really know what's going on. I had a presser coordinated by yours truly, Deborah Craig Ray, along with Dr. Pascal Mabenka, Superintendent of Durham Public Schools. And it seems that that's when it was truly a launch pad for continual information to go out to the community.
And I know most folks will recognize that you do those wonderful weekly videos, just keeping our community informed of what's a priority and where things are at any given time. And that's great. So Leslie, over time, in addition to just kind of the normal emergency management work, your office has worked to organize food drives for residents in our community that were having some challenges. You've worked to help house homeless who were being challenged by the pandemic. You've distributed PPEs and other supplies. I mean, what in the world is going on? How do you manage to keep all of those tasks on track?
Well, I have to first say, none of these things were solely my team's idea, and it wasn't just my team that made it happen. We have partnerships with over 60 organizations, and they're the ones who have made all of this work. Our responsibility is to keep it moving. We keep things moving forward. When in the beginning, when we had everyone together in the room at the Human Services Building, we were able to really reach out and touch each other in the room, if you will, to find out what the tasks were that needed to be done. And we basically just became the master taskers, making sure that every idea was talked about to make sure that we were coming up with solutions for what our community needed. Fortunately, the federal government, through the incident command system, really has a setup for us that as long as we stick with that and we stick with the planning schedules and we stick with the time frames, it makes sure that no stone is unturned and that we are able to meet those deadlines that are in place and able to so successfully, get PPE out to the public and to nonprofits to make sure that people are fed and to ensure that our sheltered and unsheltered homeless populations are both taken care of. So it is truly a team effort and just the work of master taskers.
Yeah, well, it's been awesome to, just watch everything unfold. And it just feels like each week we learn new things and we're able to pivot and serve the community with whatever is most emergent at that time. So that's really wonderful.
Thank you. And we find new things each week that we need to work on, and we love to be able to share that information both with our MAC and also with our residents as well.
Yeah. So, Rod, one quick thing. One of the things that your agency is working on, contact tracing. Why is that important in battling this issue?
Contact tracing, Deborah, is so important because when a person tests positive for COVID-19, it's just so important to trace their paths and their activities. Durham had to rapidly and comprehensively expand our ability to contact trace for all of our COVID positives in an effort to reduce transmission. Identifying those contacts, and having them to enter quarantine certainly interrupts that chain of transmission. And it does what we call box in COVID-19. So in other words, we test, we contact trace, we isolate, and we quarantine. So that's the way that you're really able to keep COVID-19 at bay. And as you mentioned, contact tracing is definitely inside the world's lexicon now, but a few people really understand. The most important thing you can do for contact tracing, Deborah, is to answer the call. When a Durham Public Health contact tracer calls, they're not calling just to, chew the fat. They're calling to really make you aware that you may be a possible contact, and we need for you to really answer the call and provide us with the information in order for us to respond quickly.
Yeah. Well, I would just like to check in with both of you in terms of your staffs. You've been at it for nearly 6 months. How's everybody doing?
We have had to require some leave for folks to make sure that they are getting the relief that's necessary. Keep in mind, the Emergency Operations Center works 7 days a week. There are no holidays. There are no weekends. We have been able to draw back a little bit with that and go more virtual. But, we did require all of our staff to take a week off to get ready for hurricane season coming in. We needed them to be sharp. And we're working with our public health team to make sure that they're taking their time off, looking at you, Rod, and ensuring that they get that much needed R&R, because we're in it for the long haul. I think we all know that normal is something that, we may not see again, and really trying to figure out how to loop the idea of COVID just into normal day-to-day operations. So trying to manage those stress levels and make sure everyone's well taken care of.
I concur with Leslie. We have mandated that our staff get some rest and respite. And we have been really, really monitoring stress levels and making sure that our staff is okay. We constantly check on them and just kind of give them all the resources that they need. We know that back to school is coming, and more importantly, we know that fall is coming, which is the start of flu season and hurricane season. So we wanted our staff to just really be able to be refreshed. And we're thankful as of lately that our case numbers have been relatively low, as reflective of those of North Carolina. And we certainly wanted to definitely have staff to take advantage of this period of slowed activity, if you will. So far, so good.
Well, I just like to say I'm so grateful to both of you for the amazing work that you're doing to keep our residents safe, and we just can't thank you enough. And we appreciate you joining us on the show today, and we will have to have you back again. And we want to thank you for your attention today. We promise to be back soon with more information from In Touch with Durham County. Cheers.